This week on Empowering Midlife Wellness, just a quick celebration to announce that the FDA has finally agreed to remove the black box warnings from estrogen products that are given to menopausal patients. The warnings that state that estrogen increases the risk of breast cancer, heart disease, and stroke, which it does not. Hooray! And welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner dedicated to taking care of women in midlife. Women like me who want to feel great now and also feel great as we age. Well, this is a really big, exciting week in menopause world because today, which is Monday, November 10th of 2025, the FDA has finally agreed to remove the black box warnings on estrogen products that are used to treat menopausal women. Hooray! For years, we have known that these so-called black box warnings were incorrect. For example, on the insert of my estradiol patch, it says that this product will increase my risk of heart attack, stroke, blood clot, breast cancer, ovarian cancer, dementia, and a bunch of other things, which it does not. It absolutely does not. And so finally, the FDA put together a panel in July of this year, only 23 years after the misinformation started, and I'll talk to you about that in a moment. But hey, better late than never, and agreed that this labeling was not scientifically up to date. So we didn't know when this would happen, but today the announcement came through that they will move forward with removing these black box warnings. Now it won't happen tomorrow because the government moves slowly, as we know, but language will be written into this package insert, which we think is probably going to be stratified by age. For example, they indicated that they'll probably state something about taking estrogen closer to the onset of menopause being safer to take this product versus taking it later in life. Now, we can argue about that part later, but this is a massive improvement because many women, understandably, would read that and decide not to take it. Many of their physicians would also read that and decide not to prescribe it because it sounds very, very scary. They don't know all of this background because it's very, very nuanced. So now, many more women will have the opportunity to use estrogen after menopause, not only reduce hot flashes, night sweats, vaginal dryness, feeling of well-being, but also reduce the risk of multiple chronic diseases. We know now taking estrogen, if we start it early, helps us to live longer because we don't die as soon from heart attack, diabetes, osteoporosis-related injuries, neurologic decline, and if we get breast cancer, which is unrelated to whether or not we take estrogen, we're less likely to die from breast cancer. So complete 180 from what we thought 20 years ago. So if you want more information about what happened 20 years ago, I've got lots of videos about that story. But today, just want to shout out with a quick little celebration about this massive move forward in women's health, not just because it's going to make estrogen available to so many more people, which is incredible, but also because it represents that change can happen. As hard as it seems sometimes, and as much as it seems like nobody's listening to us, finally, yeah, it took 23 years, but finally, the FDA put together a panel, looked into this, and is now moving forward with making a very significant change in the representation about what they believe is the safety of menopausal hormone therapy, which goes along with what we've believed for a long time. So if you enjoyed this episode, please share it with your friends. This is fantastic news that deserves to be shared. Don't forget to subscribe, and I can't wait to see you next week.